And part one of her series, COVID in Children, BNC correspondent Christine Maddela looked into how many Black children are losing their parents to COVID. Today, she digs deeper into the health disparities and also the long-rooted vaccine hesitancy in the Black community. Just as kids, again, that age group 5 to 11, are gearing up for that Pfizer COVID-19 vaccine shot.
Since 2020, the pandemic has taken a toll on communities nationwide. Johns Hopkins University researchers show Black and Hispanic Americans, though, are missing out on testing and vaccination in many states.
We know that Blacks and Hispanics are almost 3 times more likely to be hospitalized than white Americans and are about 2 times more likely to die of COVID than white Americans.
And COVID-19 is the spotlight on disparities that predated the pandemic.
Dr. Derek Robinson wears 2 masks and many hats.
And I am Vice President and Chief Medical Officer at Blue Cross and Blue Shield of Illinois.
He also still practices emergency medicine in Chicago and neighboring Gary, Indiana.
And so I still see patients a few times a month in the ER.
He broke down the existing health disparities that landed more Black and brown Americans in hospitals with COVID.
And I think it's important to foundationally say that that is not because of any sort of genetic predisposition. When we think about COVID-19 and we understand how it's transmitted, we know that many individuals who are in the African American and Hispanic communities are frontline workers, right? So these individuals have a higher likelihood of interfacing with the public. We also have lower rates of access to personal transportation. So they're more likely to be on a train, more likely to be on a bus and spend time commuting. And then we also know that many individuals in our communities live in multi-generational households. We also have higher rates of diabetes, hypertension, cardiovascular disease, and these things have to do with many of the social determinants of health, and whether that's access to food, employment, the types of jobs that individuals have. These things impact their ability to lead a healthy lifestyle. And so some would even describe that we have an epidemic of those other chronic medical conditions, diabetes, cardiovascular disease, kidney disease, that set us up for an even worse experience during COVID-19.
We met him at a Blue Door neighborhood center on the south side of Chicago, one of the centers that serves the very community he's talking about.
It's a diverse community with African American and Hispanic community, and this is one of the locations where we've seen disparities in COVID-19 infection rates and death rates in the city.
But he is proud of one statistic.
And we had over 11,000 individuals receive the COVID-19 vaccine here in their communities.
Getting that done hasn't been easy. New numbers about the effect of a new virus weren't always enough to heal old wounds, to undo decades, centuries of skepticism.
It is just my personal and spiritual belief that God will take care of me.
This is going to kill people off. That's what I feel.
The vaccine.
Yeah.
That distrust is long-rooted. It's well-deserved.
Well-deserved because America has a history of medically abusing Black people, like the notorious Tuskegee Syphilis Study, which lasted 40 years. The U.S. recruited people with syphilis. The recruits? Hundreds of poor, uneducated African American men. Researchers watched them die preventable deaths even after there was a cure. That's just one example. Since the unimaginable happened, it's not hard to imagine why many don't trust the COVID vaccine either.
Oh, I'm scared of being chipped.
Scared of being what?
Chipped.
Many of those things are ingrained in our communities, passed down from generation to generation, that create sort of a foundational layer of distrust.
That deep understanding is part of Dr. Robinson's success.
And I found myself even having to pull back on some of the frustration that I may feel as a physician to speak to the hearts of individuals who are not physicians, they're not nurses, they're not in the medical field, and they have some legitimate concerns. And so we have to listen to those concerns, address them, ask for permission to talk with them about their current decision-making framework, and then offer them some different perspectives to consider, and to keep that window open, and to try to do it without judgment.
Some doctors across the country have stopped treating unvaccinated patients. Dr. Robinson, though, is still working with them. It's a community he's a part of. It's a community he's passionate about. It's a community he wants to protect.
And so we have to continue to work with them and be there when they need us.
Dr. Robinson told us those community centers provide health care to anyone, not just those with Blue Cross Blue Shield. They also offer things like Zumba classes, becoming a staple in the communities. That has helped them spread accurate information about vaccinations. I'm Christine Maddela for BNC.